Hello, everybody. We're here at Leilani's Wellness Center, Breastfeeding Fixers and Leilani's Wellness Center. And today we're talking with Greg Gillespie about IASIS treatments, which is go ahead and explain what it is.
It's microcurrent neurofeedback. So we're applying a very small picowatt of energy to the scalp, and that works with the neural pathways of the brain, and it sets your brain back to its original default setting. So it takes your brain back to the way God originally intended for your brain to be. And when your brain is back at its original default, many or most or all of the problems in your brain will go away. So we're talking anxiety, depression, ADD, ADHD. It helps with Parkinson's. It helps with tremors. It helps with seizures. It helps with sleep. It helps with chronic pain, sharp pain. There's just anything that's related to the brain. The microcurrent neurofeedback will set your brain back to its original default.
And so, one of the things that I have seen, because we've done a few of them in our practice, and I was able to observe how effective it was for moms and babies. Since we work mostly with postpartum moms and their newborns, it can range all the way, up to usually 3 years of age. We're doing tongue tie releases, and the babies, can feel stressed. They can feel some anxiety picking it up off of mom or dad. And even the babies that have received the treatment, it's very safe for them. And we found that the babies really felt relaxed and managed the therapy or the treatment of the wound care that we did with the babies. And then the moms that were treated for postpartum anxiety or depression actually felt amazing and well relaxed, and they slept for the first time that night exceptionally well. And even a mom that we experienced had some hearing loss and tinnitus, and she said that made it almost go away completely after one treatment. So some of your patients that you've worked with, you have also done some addiction treatments for addiction as well.
Right. So I've been a practitioner for a little over 4 years, and I've treated a little over 1,400 different patients, and we've treated the whole gambit of issues. But yes, addiction is one of the things that we treat. So it's for people that are addicted to smoking. It makes the craving for the nicotine go away, so they stop smoking. For alcoholics, it makes it so that they don't want to drink anymore. And we're not talking about going through a long in-house rehab program. We're talking the patient sits down and gets a 20 to 30 minute treatment, and on many of the alcoholics, after 7 or 8 or 9 treatments, they have absolutely lost all desire to drink. Some patients take a little bit longer. Everybody's brain is different, so everybody responds differently. It also works for heroin, cocaine, and meth addiction, and other people that aren't necessarily what we would consider addicts, just normal people that have been sucked into the medical community, and the doctors are prescribing opioids, oxycodone, and things like that. We get those people off of those things also as well.
Great. There's so many different benefits to having this kind of treatment. It's safe. It's relaxing as well, as you're just having a normal conversation. You don't even realize things are happening behind the scenes, but when you use that current, it's less energy than a phone even.
Right. So we're applying. It's a picowatt, so that's a trillionth of a watt. We're actually using 3 of those. So 3 trillionths of a watt is what we're applying to the scalp. And so when you try to compare, well, what does that equal to? So if you have a cell phone, an iPhone or a Samsung type phone, and even if you just have that phone in your pocket, you're getting hundreds of thousands of times more energy radiating through your body from that cell phone than you get from our microcurrent neurofeedback system.
Yeah, so many of our moms are breastfeeding and holding their phone
Talking
at the
on
same
phone.
time or texting and stuff. So if you're concerned at all, how safe it is, well, it's extremely safe.
Right, so I believe here at your wellness center, I think there was a 5-day-old baby that was
Mhm.
treated.
Yes.
And I've treated elderly people into their late 90s. So pretty much anything in between, it's absolutely safe to use.
Yes. Great.
And so microcurrent neurofeedback originated in Europe back in the late 40s, early 50s. And so since then, obviously technology gets better and it gets safer. But there have been hundreds of thousands of people in the United States treated with this form of treatments,
Mhm.
and there has never been an injury or a lawsuit or anything like that. I mean, that's how safe this
And it's
is.
FDA approved.
It's FDA recognized.
Oh, recognized.
Right.
Okay.
So this isn't considered a medical device; it's a relaxation device.
Okay.
So the FDA has looked at it and reviewed it, and they said it's absolutely safe, but they don't control it, so they can't. They recognize it. They're saying, yes, we understand what it is and it works and it's safe, but because we can't control it, it's not FDA approved. It's FDA recognized.
Recognized. And then also, you've treated PTSD with it, and even the military has come alongside.
Right, so we currently have a fully funded study going at the University of California, San Diego, here in Sorrento Valley. It's a double-blind study on veterans that have post-traumatic stress and traumatic brain injury.
Mm-hmm.
And before that study, there was a pilot study that was done also at UCSD at the Brain Institute, and it was 100% proven to be successful in helping to alleviate PTSD and to correct brain damage.
Which is awesome. I mean, we know that there's a lot of different reasons that someone would need a treatment. We know that everyone can benefit from it from one level or another, and sometimes they need more than one session, but most of the time they're going to feel something with at least the first one.
Right, so when we give a person their first treatment, we always use the most gentle, most basic setting that we can, because everybody's brain is different, just like we're all individuals. So we don't know how you're going to respond to the treatment. So just like if you went to the gym to work out for the first time, you wouldn't use the heaviest set of weights. Right? So we start off with the most gentle setting. We look at your whole brain and we will give you a treatment, and then we want to see how you respond. And most people will see a change within 24 hours of that first treatment. How great the change is will depend on their brain. And based on their response, that will tell us, do we make it a more aggressive treatment? Do we go after specific protocols? So like the addictions, you're not going to cure alcoholism with one treatment or two treatments. That's going to be a series of treatments. There are other things, however, that one treatment will pretty much take care of it, like migraine headaches. If you suffer from migraine headaches and you're taking Botox treatments and all forms of medication, you do all those things and yet you still get the migraines. If you do the microcurrent neurofeedback, you do one treatment. People always ask me, well, how often do I have to do the treatments, or when do I need my next treatment? And my response is, here's my card, here's my phone number, you call me when you get your next migraine headache. And I have not got that phone call yet.
There you go. There you go. Well, thank you very much. If you have any questions, you can reach out to us, 760-533-7953, or look us up on breastfeedingfixers.com. Have a great day.